हाँ तरन्नुम बोलो कुछ वहां से। भाई भी डिस्प्ले कैसे चला गया? आ तो रहा है डिस्प्ले, यहाँ पे आ रहा है।
ठीक है, रहने दो रहने दो। Good afternoon, everyone. I request everyone to please take a seat and close the door, please. The cell phones can be switched off too, but we are lucky we don't have internet here, so it's a natural jammer involved here in the auditorium. It's by design. So thank you everyone for coming in a weekend to accept the NBRC Foundation Day. This is the 25th year of our foundation of NBRC. That was in 1997. Now I would first like to invite our dignitaries to come onto the stage and light the lamp before we start further proceedings. First, I would like to invite Professor Rajesh Gokhale, Secretary DBT, to please come to the stage, sir. Professor Pratima Murthy, Director NIMHANS, our distinguished speaker for today. Professor Shubhra Chakraborty from NIPGR, Director NIPGR. And our own director, Professor Krishanu Ray. Sipika. Thank you. Please clap. Now, okay. So I just wanted to say a brief word before we start the further proceedings. Even though this is the 25th year of our foundation, NBRC was officially dedicated to the nation in the year 2002 by Dr. Abdul J. Kalam, His Excellency, and President of India at that point of time. And since then, NBRC has worked steadfastly to work towards its mandates. So today I have the honor of introducing today Professor Krishanu Ray, a cell biologist by training and research, but also interested now in neuroscience of cognition, and also the director of NBRC.
So thank you, Arpan. So welcome again to today's public lecture. So we have a very distinguished set of lectures today. So first by Professor Pratima Murthy, who will talk about the brain and society. And then we have Secretary DBT, Professor Rajesh Gokhale, and he will talk about the biovision and the mission that the BRIC is going to launch into. As part of BRIC, we are also part of this family. So he will tell us what is our plan in the next, decade or so. So as you all know that NBRC always celebrates this day for as the foundation day, and where we rededicate ourselves to the research of cognition and neuroscience. So let me take this occasion again to rededicate NBRC and its commitment to excellence in neuroscience research. And since today we have a very tight schedule and Professor Murthy has to catch a flight, so I'll cut the long story short to tell you that NBRC is launching into a new mission where we would focus on studying the neurodevelopmental disorders, which include autism, IT, and the other such syndromes like dyslexia. And we had a very good 3-day sessions of symposium in last 3 days where you heard all these distinguished speakers talking about diverse aspects of the brain and the society. As you all see, is created by human brain, and therefore if we do understand the brain properly, then we will also understand our society around us. So it's a very complex system as the brain and the other tissue itself. So we will begin that today with the public lecture of Pratima Murthy. And now I hand back to Arpan to continue the session. Thank you and welcome.
So thank you, Professor Ray, for welcoming everybody. Sorry, excuse me, I have a bad asthma. But before we go from brain to society, we have to resolve one important component, that is the mind. So mind and brain problem essentially is the neuroscience avatar of the more colloquially used mind-body problem. In essence, it has intrigued philosophers, researchers, as well as theologists, and which in fact represent the entire society. If you talk about early Indian philosophy, as well as we had both these aspects, like studying the mind and the brain as a single entity in certain schools of philosophy, as well the mind and the brain as two different entities in certain dualistic philosophies. Um, as we know, the 17th century philosopher René Descartes, who has influenced the Western world with these ideas, particularly by coining the mind as something distinct and irreducible. It has some kind of irreducible form from the brain. And that is where the problem started. When we started thinking about the mind and the brain in two different entities, we landed up in a lot of philosophical and scientific problems were discovered because of this hypothesis. A long time has passed since then, and we have made enormous progress in bridging the mind and the brain. Dr. Murthy today, our speaker, is particularly worked almost 3 decades in particularly resolving some of these issues from a very clinical context, which is very important for the society. In cases where we lose the mind, such as in the case of substance abuse, where we tend to seemingly lose the mind, right? So currently, Dr. Murthy is the director of National Institutes of Mental Health and Neurosciences, NIMHANS, Bangalore, and has been instrumental in developing a lot of programs of public health from a public health perspective, particularly development of the state-of-the-art Center for Addiction Medicine in NIMHANS. She has looked at the problem of addiction, and this is what really intrigued me when I looked at her publications in Google, that she has bridged both public health and basic neuroscience and even network neuroscience approaches, which are the most modern techniques to bridge this aspect of mind and brain. Dr. Murthy is the recipient of Dr. Raja Ramanna State Award by the Government of Karnataka and the Lifetime Achievement Award from Rotary. Recently, she was honored with the WHO Regional Director Special Recognition Award on World No Tobacco Day 2021 for a remarkable service in tobacco control. She has over 300 research publications and scientific books to her credit. Before joining NIMHANS, Professor Murthy received her MBBS degree from Bangalore Medical College in 1985. She obtained DPM and MD in psychological medicine from NIMHANS in 1987 and 1989, respectively. She joined as a faculty at her alma mater in 1993 and has worked in various academic capacities since then. She is a fellow of Royal College of Physicians, Glasgow. Without further ado, I would hand it over to her to talk about this interesting topic in New Frontiers in Psychiatry, Bridging the Brain and Mind. To add one more thing, if you have any questions during her talk, the volunteers will go to you with a little cheat sheet. You can write down your question. It will be given to the moderator, which will be me, and I will direct the questions to her. Okay?
Good afternoon, everyone. Can you hear me at the back? First of all, congratulations on the founding day. I think it's very exciting to really, come together and celebrate what your institution has done over the last more than a decade, and really look to rededicating yourself to how you can take your institute and science forward in the decade to come. I'm very pleased that the Secretary DBT, Dr. Rajesh Gokhale, is here, the director of the institution, all the faculty, all the distinguished invitees, and of course, the students, the postgraduate students. I just wanted to say I enjoyed the posters that all of you have prepared for today's open day. I'm sure it made all the students who came here very curious about the aspects of the brain and mind in both health and disease. And that really was very nice to really see the spectrum of the areas that you've already all covered in this exhibition. So what I thought I would talk to you, I'm basically a clinician, a psychiatrist by training, but what I've tried to do together today is to really talk about some of the exciting frontiers in psychiatric research, but more importantly, towards the end of my talk, I'll try and tell you why it's so important to have a holistic understanding of the brain and mind. So philosophy apart, I'm certainly not going to philosophy. I'm merely going to make a case for why it's important to study all of these conditions together. It's not moving. Yeah. Next slide. Just go back. Previous slide. Previous.
Yeah, little bit slower.
Let me go back to the previous slide. Okay. No, even before that. Yeah. So, first of all, I want to tell you what I'm going to be talking about today. I'll start off with talking to you about neuromodulation. I see that there is interest even in this institution in neuromodulation, and we'll see some of the application of neuromodulation in various clinical conditions as well as research. Neuroscience informed treatment and neurobiology, and how neurobiology has actually helped us to formulate more specific treatments with less side effects, particularly in psychiatry. I'm going to talk about precision psychiatry. It's always a challenge for people to look at public mental health on the one hand, public health on the one hand, and look at patient-based precision medicine. But I think it's very important to understand the spectrum of both of these things to be able to deliver the best care, not just for all people, but also for specific people with specific disorders. Digital mental health has been revolutionary, especially during COVID, and it's helped us to reach a whole lot of people. And therefore, we'll talk a little bit about the digital, the digital revolution in psychiatry. I was talking this morning about neuroinflammation, and both neuroinflammation and immune understanding, the mechanisms from an immune point of view, have also changed the way we think about psychiatric disorders. But on the one hand, although biological understandings have definitely impacted the way we understand mental health, so has the impact of culture. As we all know, the human being is not in a sterile petri dish. The human being is constantly interacting with the world around us, and therefore culture and local context become very, very critical in the practice of psychiatry. There have been some development in psychotherapy, although that may not be of particular interest to this group as scientists, but as receivers of interventions, it becomes very important for you to know about this. Finally, I'm also going to talk a little bit. I have one slide on psychedelic assisted therapies because that's where the world seems to be going. But of course, I'm going to talk to you about the advantages and the challenges there. AI and machine learning, you probably know about it much more than I do, but I think it's important to talk about that as one of the revolutions in psychiatry, as in other fields of medicine. Virtual reality and its applications, that's also very important to understand. How have our diagnostic approaches changed? What are the pitfalls and precautions we need to take when we look at these new frontiers in the practice of psychiatry? And then, of course, you have to mind the gap between neurology and psychiatry. Why I said mind the gap is those of you who have taken the train in the UK anytime will always hear this, this announcement, please mind the gap when you're getting in onto the train and getting off the train. So really, there is a gap between neurology and psychiatry, and we just need to see how we can bridge this gap between the mind and the brain. So I'm still having a problem advancing. So the first part of it was going to be on neuromodulation. Now, the idea that electricity can actually affect the brain is a very, very old concept. So the Roman emperors, as you will see, had electric eels giving them little shocks, and that made them feel better. And if you look at this particular article, which talked about a set of people in Indonesia lying on electric tracks because it helped them feel better. What a dangerous thing to do. But nevertheless, the fact that these small electrical waves, cause people to feel better, cause both their anxiety symptoms to get better, their depressive symptoms or their mood symptoms to get better, their somatic symptoms to get better, has resulted in a whole lot of treatments which are based on either producing shocks or seizures for people to get better. Okay, my suggestion is I'm going to stand and talk there and say next slide, and that might work better. Yeah, so we'll do that. So the important thing to understand, just go back, please. A little bit behind. Yeah, the next slide. Yeah. So how has this actually influenced the treatment of psychiatric disorders? These are the gaps. This is another gap to mind. You know, when we have so much technology going our way, but suddenly technology gives you a rude jolt. We'll just wait a couple of minutes. So let me also, in the meantime, let me tell you the story of how neuromodulation actually developed. So I cannot separate that story from the story of NIMHANS itself. In fact, my first couple of slides were inviting you to NIMHANS. We'll get them back somewhere. And NIMHANS is now celebrating 70 years as the All India Institute of Mental Health, which was the first postgraduate institute in the country, and 50 years of the formation of NIMHANS as a combination of the mental hospital and the departments of postgraduate mental health, neurology, and neurosurgery. That happened in 1974. So we are celebrating our 50th year of that. So what you need to know, is it working okay? Can I try? Thank you. It's okay. Up and down. Perfect. Okay, great. All right. So these are my first slides, and I'm going to go back to my first slides, which got missed. And this is the beautiful campus of NIMHANS. I know your campus is beautiful too, and I believe you get leopards and deer. We don't get those. Fauna. And particularly if you come during February and March, all the Tababuya rosea trees are in bloom. And legend goes that these were specifically brought from South America and planted here. And just being in this serene atmosphere is very helpful for patients to get better. So do visit NIMHANS sometime if you can. And these are some of the different areas of NIMHANS. You'll see that we have a fountain in the shape of a brain with water running it to depict CSF. This is the oldest building of NIMHANS, which is the Department of Psychiatry, which was established in the 1930s. And then we have the Neuro Center, which has neurology and neurosurgery patients, and that completes 50 years this December. And of course, we have what was the administrative block and the basic science departments. I know many of your faculty have visited the basic science departments, and the administrative block, of course, has moved. And we hope in the ground floor of this building to have a museum of the brain and mind so that we can engage young people to get interested in learning about the brain and mind. I also wanted to tell you that now I'm behaving badly, no, sorry. Okay. I also wanted to tell you a little bit that our major focus is really both on understanding the basics of brain anatomy, physiology, and functioning to converting it into patient care. This is a picture of all our patients during one of our recent Independence Days, where patients all come together, participate in various kinds of sports activities, and get their prizes. The point I'm trying to make is that as an institution, we're constantly thinking of how any kind of research we can do actually translates into better care for patients. As a country, we've reduced mortality from many, many conditions, but the quality of life and the disability, particularly from neurological conditions as well as psychiatric conditions, are things that we're very concerned about reducing as well. We've finished the slide. So now I come to the fact that electricity produces change. And in the early 1930s, at the All India Institute of Mental Health, and before that, the Mysore Government Hospital, one of the things that was constantly given to patients to produce seizures was camphor, followed by cardiazol. So people got an injection of cardiazol, they developed seizures, and they got better after that particular seizure. But clearly, chemical induction of seizures comes with a lot of, lack of control over the intensity of the seizure, the frequency of the seizure. They're not the best ways of giving seizures to patients. And then, of course, we move now, to TMS or transcranial magnetic stimulation, direct current stimulation, as well as deep brain stimulation. And we know that there is evidence that TDCS is useful in a variety of conditions, starting from attention deficit hyperactivity disorders, obsessive compulsive disorders, schizophrenia, depression, as well as substance use disorders. We also know that stimulation of the vagal nerve can also produce benefits in mood, in substance, in the use of substances, and so on. Deep brain stimulation has also gained a lot of popularity, particularly in patients who have refractory OCD and other symptoms, and the idea is that there appears to be a network modulation through the intervention of these surgical procedures. And of course, it allows for a better understanding of the brain when you look at the functional connectome under neuromodulation. And that's been seen in a variety of conditions where you actually place electrodes and stimulate particular parts of the brain to produce these seizures. So, neuroscience informed treatments include, of course, TMS, and TMS has been possible because we've understood the circuitry of the brain much better. We know, for example, that the neuropsychiatric symptoms, whether it's of depression, of negative symptoms, or memory impairments, they involve certain circuitries in the brain, and stimulating these circuits causes improvement in these heterogeneous group of conditions. And it's very exciting to see now that TMS is still a very diffuse kind of treatment. TDCS is also a very diffuse treatment. Can you now narrow down to the locus of where symptoms are produced? So, for example, you might find, like you do lesions, for example, when you have a single epileptic focus, you can do a neurosurgery. Similarly, perhaps if a patient has only hallucinations, you probably will be able to locate the part of the brain which needs to be stimulated. Or if the person has only delusions, what do you do? So that kind of precise localization of symptoms of psychiatric illness might have answers in neuromodulatory treatments. Similarly, when you look at the neurobiology of depression, you obviously need to understand what are the neural circuits that can get affected in a person with depression. Now, here I must state that when I say depression, I mean a clinical state of a depressive episode. I do not mean the normal, and there's a lot of confusion between normal mood changes, feeling low at sometimes, and a clinical diagnosis of depression, which has certain diagnostic criteria in terms of the duration, in terms of melancholic symptoms, in terms of not being able to enjoy things that the person previously enjoyed, having biological symptoms, having negative symptoms, including suicidal ideas. The constellation of these symptoms occurs in people who have a major depressive episode. There is a familial tendency to major depressive episode. People with conditions like hypothyroidism may be more prone to depressive episodes, and that's the kind of depression that I'm talking about. And here you'll notice that there is a kind of imbalance between the dorsolateral prefrontal cortex and the cingulate cortex. And this kind of anti-correlation, which can get corrected by the neuromodulation, is said to underlie the response of for TMS in depression. So the whole idea is to enhance the RTMS to the left dorsolateral prefrontal cortex, enhances the anti-correlations between these two areas, and that possibly leads to better clinical outcomes. I must also state that it's not as if neuromodulation has really resolved the problem of depression. There are studies which suggest that there are positive outcomes. There are studies which haven't found such exciting positive outcomes. Therefore, it's what I'm talking to you are newer frontiers, remember? And therefore, the jury is not out on all these treatments, but the excitement that these may offer definitely valuable interventions for patients remains very important. Now, when you look at the negative symptoms of schizophrenia, so we know that a condition like schizophrenia can cause positive symptoms. Positive symptoms are hallucinations, hearing things that other people don't hear, delusions, abnormal false beliefs that somebody is out to persecute them, is controlling them in a certain manner, and so on. What are called first rank symptoms, believing that somebody is making you do something, believing that somebody is taking control of you, believing that they're making you do actions that you wouldn't otherwise do. Some of these core symptoms of schizophrenia are positive symptoms. But we also know that patients have negative symptoms, which is typically anhedonia, no interest in anything, avolition, no voluntary effort to do anything, apathy, disinterest in everything. These kind of 3A's are typical cardinal features of negative schizophrenia. And we know that when you look at the connectome-wide association, you can understand that there are connections which correlate between the DLPFC as well as the negative symptoms. So there appears to be a breakdown in the left dorsolateral prefrontal cortex with the midline cerebellum connectivity, and that seemed to be associated with the severity of negative symptoms. And therefore, you'll see that giving neuromodulation may actually improve the negative symptoms of schizophrenia. The problem is that in the treatment of schizophrenia, we have drugs which help with the positive symptoms. We do not have very effective drugs that deal with negative symptoms, and therefore neuromodulation appears to offer some promise in this area. Similarly, when you look at the neurology of memory, you'll find that the lateral parietal hippocampus complex, that connectivity modulates the declarative memory, and TMS is possibly, helps to engage the left hippocampus by stimulating, the individualized fMRI guided lateral parietal cortex, showing better improved connectivity with the left hippocampus. The treatments with TMS in about a week. Similarly, neuromodulatory methods have not been only confined to depression and to schizophrenia and to memory deficits, but also been used in movement disorders quite effectively, particularly in patients who do not respond to anti-Parkinsonian drugs. That's another important thing to remember. Now I move on from neuromodulation. I haven't spoken about DBS because deep brain stimulation is, we don't have that kind of evidence, although there are some very exciting papers in leading journals about the use. The use of deep brain stimulation in India is somewhat limited, but people will swear that being able to stimulate certain areas in the brain will actually improve people's thing. One example is from Dr. R.M. Verma. He is a very leading neurosurgeon who turned 100. He passed away a few years ago. He turned 100, and he was a former director. And he used chemothalamotomy, injection of medication into the thalamus to take care of the Parkinsonian tremors. Since then, we've moved to more refined ways of neuromodulation, which has lesser side effects. So people are talking about, like you have cardiac pacemakers, the fact that you can have pacemakers which may actually give intermittent currents in the brain to help people with some of these disorders. I move now to some of the other areas, and the other very important area is depression during pregnancy. Now, depression during pregnancy is again very, very important because you're worried about using drugs, especially in the first trimester, because of the teratogenic effects that they can occur. The second thing is that because the mother is carrying a fetus, you want a drug which will have a rapid action. If you know the pharmacology of antidepressants invariably take at least 2 weeks before the antidepressant effect can kick in. And therefore, you're looking at something that does it much quicker so that the mother can take care of the baby. And therefore, you have a new frontier in pregnancy, which is oral allopregnanolone, which was approved just in August 2023. And what does it do? It acts on the GABA neurons, and it helps to treat postpartum depression in adults. And there's another drug, zuranolone as well as brexanolone, which can reduce depressive symptoms in as low as 3 days after it's initiated. And therefore, it becomes a very attractive pill. Of course, there are 2 RCTs which have demonstrated the efficacy of zuranolone, but the point is that we are constantly looking for medications which act quickly, particularly in psychiatric symptoms. So that's one breakthrough. Similarly, in Alzheimer's disease, all of us know that in Alzheimer's disease, the drugs that were available have limited effectivity and they have a lot of side effects, whether it's donepezil and similar drugs. And therefore, there's another drug called lecanemab, which is a disease-modifying drug which appears to be a monoclonal antibody which binds to amyloid beta, and this has shown efficacy in reducing amyloid deposits in early Alzheimer's disease and showed moderately good effects in terms of less decline in cognition and functioning. So again, in these 2 important areas, we are looking at medications, and there are some medications which have promise. And the whole idea of such medications is their focused way of acting, their quick duration of action, and hopefully fewer side effects than we have with traditional medications that we know. I must also add that sometimes there are a lot of fears about side effects as far as medications used in psychiatry are concerned. One must know that every medication has side effects, whether it's medicines used for hypertension, for diabetes, and in some ways, the drugs used in psychiatric conditions are very, very effective. They help the person get over their symptoms and be able to function. And therefore, sometimes there's very bad press for psychiatry and for psychiatric drugs, but we need to understand that when used appropriately, they're extremely important, and invariably, in addition, if you have psychosocial interventions, you can bring about a lot of restitution in terms of the person's functioning. Another very, very favorite topic of the day is the gut and health and disease. Everything now is kind of focused onto the gut. And of course, the understanding of psychiatry also grows there. The gut axis in psychiatry, we know that gut microbiota are important both for physiological processes, immune functioning, as well as mental health. And we know that there is a bidirectional communication between the gut and the brain. And therefore, there is a constant interaction between the functioning of the nervous system, the immune system, and the endocrine system. Any disruption in the gut microbiota has been associated with depression, anxiety, and the autism spectrum disorder symptoms as well. And therefore, considering that dysbiosis can lead to inflammation, and the inflammatory theories are now emerging for depression as well as for schizophrenia, it is possible that agents that alter or change the gut microbiota or stabilize the gut microbiota may be useful in the treatment of these disorders. And therefore, probiotics, prebiotics, as well as dietary modifications seem to be important to improve mental health and reduce the risk for depression. And here, some of our traditional Indian systems of medicine may offer solutions as well to stabilize the gut, and I'll talk about it in a bit. And therefore, again, personalized approaches are being explored to target the gut-brain axis, and these include interventions based on the individual's own gut microbiota. I mentioned precision psychiatry. So right now, as a country, of course, we want to make sure we deliver mental health care to the masses. COVID has been a very, very important time when we realized how important mental health is. We have something like the Telemanas, where you call 14416 and you can get some degree of psychological counseling. But in addition to these kind of public health engagements, we also need to look at mental health treatments to individuals based on their unique genetic, neurobiological, and psychosocial characteristics. So I think it's important to look at genetic factors, neuroimaging factors, biomarkers like blood or neurochemical signatures, which can all help in tailoring medications, looking at people's genetic and neurobiological profile. I can't yet give you examples of specific things that are happening, but the research is moving in that direction where you're looking at precision psychiatry and personalized medicine. So certainly, for example, in psychotherapy, we know that person's personality, their cognitive style, and life experiences actually determine the kind of psychotherapy that people choose to help the patient. It's possible that machine learning and data analytics can predict outcome as well as relapse risks and help clinicians make informed decisions about what to use where. Novel therapies can also be targeted at specific mechanisms underlying mental health disorders, and prevention and early intervention also, particularly if you know what kind of risk factors makes the person more prone to a relapse, can help you to plan interventions for that particular individual. So it certainly promises to be more effective in terms of mental health treatments and reducing the side effects, as well as enhancing the overall well-being. But we will still have to wait and see what kind of drugs or what kind of interventions hold that promise. I was telling you about the telemanas where you call 14416. This is an example of how it has been set up in the country. In just over a year, the telemanas has been able to reach almost 5 lakh people from all parts of the country. And this telemana cell has been set up in every state and union territory. And there are trained counselors who take up the telemanas call if they have succeeded in not just providing counseling, but in preventing suicides, in helping with substance use disorders, and so on. They are helped by mental health care professionals, as well as there are regional centers. And NIMHANS is the apex nodal center. The idea why this is very important is because we have a deficiency of mental health professionals, particularly in rural and underserved areas. This is a real boon so that people can get help wherever they are in the country. And we know that there can be many more technology applications in mental health. We all know how mobile phones have really, revolutionized the way we can deliver healthcare. There are lots of e-health applications. A lot of passive data can actually be collected through technology. People know that journaling or writing down their events of daily life can help them to overcome some of their problems. There are gesture recognition devices that have been used in ADHD and autism. Body movement detection can be very helpful in people with dementia. Just like you have alarms for children, body movement can be very helpful to make sure, somebody hasn't had a fall, you know exactly where they are, as well as eye tracking devices. And therefore, you see that with technology, there is some amount of democratization and reduction of stigma, and some kind of gaming has also developed for mental health. In terms of personalized therapy, biofeedback and digital phenotyping has been possible, and through various kinds of engagement using concepts like mixed reality and metaverse have also become possible in psychiatry. My colleagues have done some research on something called the Mind Lamp. LAMP stands for Learn, Assess, Manage, and Prevent. It's basically a smartphone app which captures a lot of physiological data and can offer tips to patients because of the captured data. So a person with schizophrenia who has the Mind Lab data, you know how much physical activity there has been. And this might help you to actually gauge that the person is at risk for relapse. Agitation sometimes is the first step to tell you that there's a relapse. So sometimes these devices can actually measure that kind of agitation, measure the amount of sleep that the person is having. So, these kind of apps can be very, very useful in getting personal data and helping to predict relapses. So this is something called what the Mind Lab does. It helps people to assess their moods through journaling. It helps to look at social contacts. It helps to look at autonomic symptoms. It also helps them to assess their own mood state. It helps them to set new goals, to take their pills in an appropriate way. And it also helps to prevent mood anxiety and relapses. So these are some new technologies and applications that have become very helpful in trying to help people with schizophrenia. And this, of course, is being researched quite actively. So this is a paper that my colleagues were all involved in, which says Mind Lab to predict relapse of symptoms in schizophrenia. And therefore, this becomes very, very interesting in terms of a technology-based intervention to address mental health disorders. Let's move on to neuroinflammation in psychiatry. We know that neuroinflammation is a natural response to any kind of disturbance or attack on the brain's immune system. It might be due to infections, it might be due to stress or any other stimuli. And neuroinflammation has been associated with depression, schizophrenia, bipolar mood disorder, as well as anxiety disorders. And of course, we know that immune molecules like cytokines and chemokines can contribute to symptoms of mental illness. And chronic stress can also cause a release of some of these chemicals. And neuroinflammation is not only associated or described with psychiatric conditions, but equally in neuropsychiatric conditions like Alzheimer's disease, Parkinson's disease, and so on. And the fact that NSAIDs and cytokine inhibitors have been found to play a part in ameliorating some of the symptoms of stress allows us to look at these as potential markers. I don't know if you remember during COVID time, some of the antidepressants actually came to be used or tried out in COVID because of their effect in terms of anti-inflammatory effects. So there's a lot of excitement about using possibly anti-inflammatory treatment in the treatment of psychiatric disorders. Now, interestingly, this is some of the drawings that I'm going to show you were done by kids during COVID, because I think this was a representation of what they thought. So I thought today you're having a lot of kids here. So getting kids engaged is very, very critical in understanding science and understanding conditions, So this is a kid talking about what you need to do and, how you need to say goodbye to people who have died, and how rest, etc. is very, very important and what you can do at home. But the most important thing that someone described in terms of what happens with COVID is the behavioral immune system. So I'm taking you a little bit outside to look at the ecology of behavior. And has COVID, we all struggled with COVID for 3 years. Has COVID made us different? Has a pandemic, does it teach us to conform more? Or does it teach us to become eccentric and rebellious? Think about it. Think about how each of you have actually responded to COVID in different ways. Are we becoming more morally vigilant? Will it lead to more distrust of others, or will it lead to instinctive social distancing or a sense of wanting to help each other? We can debate on what COVID has done initially, during COVID, and after COVID, but these are very, very important things to think about, particularly after we've had a pandemic like COVID, or will we come out more resilient and compassionate? I think this is something seriously that we need as a society to think about. So COVID has also been a very stark reminder of our inequalities, our vulnerabilities, as well as our social protection systems and public services, the serious economic consequences, the digital technology boom, but it has also magnified the inequity in society very, very well. Now, in that context, let's move to cultural psychiatry, where we obviously cannot have treatments in a vacuum. Treatments cannot be given like in a petri dish. They're not in vitro. They are treatments to people who are alive, who are constantly in the context of their families, etc. So it's very, very important to understand cultural awareness, cultural knowledge, sensitivity, communication, collaborative decision making with patients. It's a misconception to think that patients with psychiatric disorders cannot engage in treatment decisions. And we know from a human rights point of view that they certainly can. So therefore, it's very important to contextualize whatever treatment we have in the context of the individual, which takes you back to the personalization based on the context. And our integrative center at NIMHANS is a typical example of this, where we combine allopathic treatment with Ayurveda as well as yoga. There's a lot of research which happens to look at genetic mechanisms in terms of the effect of yoga, the different body constitutional types and what works for each of them, what kind of Ayurvedic medicines are useful in various conditions. fMRI changes with yoga and other Indian forms of treatment, and therefore it becomes important then to look at a context where you integrate all kinds of approaches for better health care. I won't focus too much on psychotherapy. It's important to understand that there is a much greater demand nowadays for psychotherapy. You'll see that various psychotherapeutic companies have sprung up everywhere. They are, highly monetized, and therefore it's very important to understand that there are applications of technology in terms of teletherapy, chatbots, virtual reality, and so on. Evidence-based therapies like cognitive behavior therapy, dialectic behavior therapy, and mindfulness meditation have certainly, become important. But it's also important to understand the cultural competencies to decide which psychotherapy is useful. Yoga and mindfulness and mind-body treatments have become very common these days. Trans-diagnostic approaches, where you borrow themes from different kinds of disorders, has also become important. Neuroscience-informed therapies, and that's where I was coming to. So there are ways in which you can modify maybe your executive function, because you know that the frontal lobe deals with executive function. So how is it that you can change your judgment, your assessment of things, etc., by doing exercises that focus on executive dysfunction, internet-based CBTs, integrative approaches, and of course, doing empirical research on outcome and measurement has also become important. A word on psychedelics. Strangely enough, we've known psychedelics are not new. Those of you who are aware of the Beatles will know that they had this nice song of Lucy in the Sky with Diamonds in the 60s and 70s. But now the point is that several psychedelics have emerged, particularly both in psychotherapy and to treat resistant depression and some other conditions. Drugs like ketamine, LSD have also been starting to be used to aid psychotherapy and so on. However, the recent review of evidence suggests that the studies are in. There's substantial polarization in the field, and the danger is that we may have some form of cosmetic psychopharmacology that emerges, and that is the danger of having, without adequate evidence to base it up, the use of these substances. A lot of young people find this very attractive. That's why I thought I should mention it. The jury is not out on this. There is not enough evidence for this. Finally, the most important thing perhaps to look after our own mental health is the element of self-care, which includes awareness, how are you more mindful and relaxed, having a healthy lifestyle, social support, journaling helps a lot of people, goal setting and self-care. There are various other techniques to manage one's emotion, one's thinking, and one's behavior, including various apps and so on. And that brings in AI in psychiatry, where there are lots of sources of input data. We have lakhs and lakhs of records, for example, which are digitized, which can be a great way of determining what helps which patient. And they can be with investigations on imaging, with history, with assessments of autonomic functioning, with self-report data, as well as various other newer and innovative methods of using AI can also be helpful. Virtual reality certainly has been used, for example, in autism spectrum disorder to help kids negotiate social spaces, in post-traumatic stress disorder, in addictions, in phobias, and so on. So virtual reality, again, is something that people have used for exposure and response prevention for various psychiatric disorders. Okay, Now, this is something that possibly many of you may not be very well aware of, but the fact is that in medicine, we've had the ICD diagnosis and the DSM diagnosis. These consist of a constellation of symptoms for a particular duration of time, and we know that they may not be very precise. So people are talking about having classifications based on circuitry of the brain, based on the reward network or the fear network, based on symptoms, or based on functioning as important influences, and therefore it might actually change the way we look at psychiatry and make diagnosis a much more integrative, multidisciplinary approach rather than a categorical approach of major depressive disorder, bipolar mood disorder, or paranoid schizophrenia. So that's where we're looking at in terms of diagnoses, understanding people better. Now, whatever, I'm going to end with the last few slides. Whatever I've told you in terms of the frontiers of psychiatry, there are also important precautions and pitfalls. First of all, the robust evidence is not present for many of these, but then you can't always wait for robust evidence. You've got to find some breakthroughs and innovations and test them out. Availability, affordability, and accessibility become important. Cost and equity become important. Ethics, particularly, for example, in terms of psychedelic treatment, may be important ethical and legal issues. And of course, we have no control over the exposome. What happens around us is something that is so much variability that becomes a very, very important and difficult thing. And of course, we are talking about digital citizenship, which is how can we be responsible digital users. And finally, science has a tendency to progress more by disproofs than by proof. And that's something that all of us as researchers must be prepared for, that very often we put so much effort into something and we don't find that that's particularly effective. We must have the courage to accept that and to move on. I'll just tell you about a couple of initiatives at NIMHANS, because I think that's very important to bring in together and bridge the gap. This one is a program that was called the ADBS program and was very generously supported by the DBT for 5 years. And now it is being supported by the Rohini Nilekani Philanthropies. And this is a collaboration between NIMHANS, NCBS, and INSTEM. So we've actually developed a huge set of neurobehavioral cohorts, neurodevelopmental cohorts, and we're looking at the genetic influences as well as the environmental influences that might influence both brain development and the development of disease. So we're looking at a combination of genetic, molecular, as well as cell biology research, along with clinical phenotyping, imaging, neurocognition, as well as electrophysiology, identifying the predictors of long-term course. And of course, we have comparisons with international data sets. We've been able to train a lot of PhDs and other scientists in this effort. Most importantly, it has helped us to create a cohort. We're now trying to do a similar cohort with Parkinson's disease as well as with atypical Parkinsonism, with dementia, and with other conditions, so that we can really follow up patients, but more importantly, look at the risks for developing these conditions and seeing if we can arrest these risks. So, for example, we're looking at childhood adversity. We're looking at early environments. We're looking at cross-cutting symptoms across OCD, schizophrenia, bipolar mood disorder, dementia, substance use. And that is going to perhaps give us a lot of very important leads. And certainly we're very thankful to the DBT for actually funding the first part of this particular study. Karnataka Brain Health Initiative is something that the government of Karnataka has taken to train people who are in secondary care and primary care to identify common neurological disorders. So headache, migraine, early risk factors for stroke. How do you identify that? And 2 days ago, the Karnataka government has also agreed to fund an acute stroke and an acute neurotrauma facility in a medical college, so that all people need not converge very, very far away to places like NIMHANS, but can be treated. This is also a great opportunity for research on the ground to really look at pathways that people need to travel to get, medical help for these common conditions. I also wanted to add that there are a lot of opportunities both for undergraduate and postgraduate courses. We offer more than 90 courses at NIMHANS, starting with PhD courses, of course, the medical courses, which include the MCH, the DM, the MDs, postdoctoral fellowships, undergraduate courses in nursing, anesthesia, and radiology, fill courses. The terminology will change, but they will continue to be trained in these conditions, as well as, of course, various diplomas that we offer. So I think in terms of a lot of academic training, this is our strength. I wanted to end with something that many of you have mentioned today, and that is our brain museum. And Dr. Gokhale, you must visit this brain museum because it's really transformational. It has a lot of specimens of the brain in health and in disease, and many colleagues here are using some of our brain samples for their work, for their basic science work. IIT Madras is using it to maintain a developmental kind of understanding of the brain development based on these. So several people, the CBR is using this. So this is a fascinating collection, thanks to Dr. Shankar, who started it, where we have this. This was supported by the ICMR when it started. And of course, what more would you want? On a day like this, I thought this is a visual image that you should go out with. I know you've had kids from the 10th, 11th, and 12th perhaps, but the idea, this is just about a month ago when 6 and 7-year-olds came to the Brain Museum. We're wondering what would they do in the Brain Museum, but they were so excited that, just to understand what's inside their mind. And the whole idea is for us to have an interactive brain and mind museum where young people come and understand the working of the brain, how they can control their emotions and behaviors, how they can avoid risk factors. What is it like to have a neurosurgery? The entire gamut of neurology, neurosurgery, and psychiatric symptoms, we hope to be able to teach the public about these kind of interventions. We have a lot of collaborations, both with national institutions, and I just put this up because as you see NCBS figures here, several others as well. We have international collaborations, particularly with the United States of America, several places in Europe and Australia. Of course, we need to strengthen our work with South America and Africa. And of course, the Parliamentary Committee, in one of their recent things, have told us that we need to expand whatever we know to more South Asian countries. So perhaps that is something that we need to do, not confine the knowledge to ourselves, but really to share it with others. And we have a large list of international collaborations as well. I just mentioned two. With the University of Liverpool, for almost over a decade, we've been having an exchange program, particularly PhDs as well as junior and senior researchers, as well as the University of Maastricht. Where is Maastricht? Yeah, University of Maastricht. We have this exchange program. It's working quite well. And we hope that we'll be able to strengthen some of these collaborations so that scientists from both areas will be helped. Looking ahead, we obviously need to have a developmental approach, and then I'm glad that the NCBS is looking at children and adolescents and looking at some of the issues that that affect them. And similarly, we need to go through the adult trajectory to the elderly and look at the various research that the elderly need in terms of mental health and neurosciences. Understanding neurocircuitry and psychopathology is very, very critical. And this is true whether it's for neurological disorders or for mental health disorders. Because invariably, whether it's neurotrauma, whether it's neurological conditions, degenerative ones, there is invariably an overlap with psychiatric symptoms. We obviously need better tools and better approaches to understand disorders. Most importantly, we need to see how we can prevent many of these disorders, because particularly for NCDs, we know 60-70% of them are preventable if you address the risk factors. Early intervention, but restitution as well is very important. Therefore, we need a multidisciplinary, multi-technology, and a bridged understanding of the brain and mind. We know that without the brain, there can't be a mind. We also know that the mind is much more than the brain. Yet, as scientists, we know that these two are very, very closely interacted with each other, and we should work together as professionals to understand this. And I'll, of course, end with Robert Frost. And why am I ending with Robert Frost? The woods are lovely, dark, and deep, but I have promises to keep and miles to go before I sleep. I'm saying this because for those who are entering research, in the initial stages of research, this is a fantastic time for you. You have so many things going for you. You have the equipment that is fairly state of the art. You have people who've laid a path for you and maybe collected samples for you to test. They've developed ideas which you can take forward. The world is at your fingertips, and therefore I think you should use this opportunity to really grasp and understand the nuances of these kind of interactions and develop a holistic understanding. You may be focusing on a very, very narrow area of work, but develop a holistic understanding. And finally, don't lose that ambition of wanting to change the world. Every one of us has the capacity to change the world in some way, and I hope each of you will. Thank you very much for having me, and I'm going to stop.
We have time for one or two questions. So one of the questions was, in the age of internet information, too much information load is there. So does this make us more prone to psychiatric disorders?
There's a lot of accruing evidence that there are, of course, there are positive sides of technology and using the internet, lots of stuff. But there is also enough evidence that spending an excessive amount of time on the mobile phone, on the internet, can actually cause more psychiatric symptoms, particularly mood and anxiety symptoms, make people more socially isolated, and of course have a lot of other physiological symptoms, from back pain to impaired memory and so on. So there's a substantial amount, and that's the irony. Especially in old age, people say you have to stimulate yourself, be cognitively stimulated on the one hand, but anything obviously in excess can be problematic, and that's what people are recognizing much more. So there is an optimal use, and we have to find out what is the optimal use for each one of us.
Thank you. So I think there is a question on alternative therapy and yoga, but I would like to pose it in a slightly different way. So we have journals like molecular psychiatry, biological psychiatry, and particularly when it comes to medication. So this has been kind of sort of advanced by trying to particularly arrest a particular molecule for a particular to treat a particular symptom. So however, when we track certain symptoms in terms of the brain, we track the brain dynamics or some functional parameters. So how do you see the role of this alternative medicine with tracking the molecules to sort of a functions perspective? Does it really have a kind of a role there in terms of, does it affect both in terms of function and the molecules?
Let me just understand your question. Does what affect?
So the yoga or kind of alternative medication, does it? So you have to affect both the molecules as well at the functional level. So we tend to think of it affecting the functional level, and that's we see the cause and effect.
Okay.
But so, does it affect the molecules also?
The intermediate step, is that affected by doing yoga, or is it the final effect? That's what you're asking.
Yes.
I mean, there is growing literature. I see, again, what happens is a lot of the research is siloed. So you would have, let us say, studies on yoga and fMRI. You would have studies on yoga and genetics. You would have studies on yoga and neurochemical changes. But I think it's very important now to consolidate all these findings. And that's why it becomes important for people with different kinds of backgrounds to come together. The geneticist, the cell biologist, maybe the biophysicist, as well as the radiology person, as well as the clinician. I think if we all come together and learn to talk to each other, unfortunately, we have our own languages. But I think that's why I'm emphasizing that you have to look at the bigger picture, and each of us try and understand how what we do fits into the bigger picture. And I think that's where the solution lies.
Thank you very much. So with that, we'd like to thank you, Dr. Murthy, again for coming here and give a talk. And I would like to invite our director, Professor Ray, to initiate the proceedings of felicitation. So you have to wait for a moment.
Just turn on the lights. Okay, so it was really a fascinating talk, and it covered a huge gamut of issues that all of us have been thinking and talking about and wanting to know more. And really thank you, Professor Murthy, for coming, taking your time, and this lecture, which has truly been a public lecture. I think both the specialist as well as the lay person will understand what you said today quite eloquently. So with this, I would like to, offer a memento of our appreciation to you. And yeah,
So I would like to invite Rajesh Gokhale, Dr. Rajesh Gokhale also on the stage. So you have to also say those words on biovision. I'd like to invite Professor Gokhale also for a token of appreciation from NBRC. So I'd like to request Professor Gokhale to give a presentation on the biovision. Did that?
It is open already.
Okay, wherever. Yeah, first of all, let me first thank Professor Murthy for such fantastic, stimulating lecture. Actually, I think it was really, really enjoyable about brain and all the aspects of brain that is so critical to human life, and obviously the center of this institution's heart as well. Actually, so I think we should all really have a big round of applause for that. Actually, I think it's a fantastic. So I also want to congratulate from my own side NBRC family, and therefore I wrote down this poem. I thought it's worth sharing with all of you actually, and this is about what it says all about what you folks do actually. And this is in the heart of knowledge, sacred shrine, where neurons weave their tales divine. A heaven stands a beacon bright, NBRC a realm of light. So 25 years of NBRCs is actually a fantastic thing for you. I think it says a lot about us. It's a smaller institution, but it says tremendous amount of what value it has created for all of this. Neuroscience, the noble quest in NBRC, it finds its nest, the tapestry of synapses, vast in every corridor, the future cast. Beneath the canopy of neurons dance in NBRC, minds in harmony enhance, exploring realms of cerebral sea, a symphony of curiosity. Through fMRI's lens, secrets unfold in NBRC chambers, tales are told of cognition's dance in patterns grand, a poetic embrace in neurons land. And I hope this is a neurons land actually. From dendrites reach to exons flight, in every pulse a story to recite. a ballet of signals, a dance of codes in NBRC, the mind's a sense unfolds actually. I think this was just an attempt of mine to try and do it, but obviously the real author of this is this. And this is just to give you a fact that even ChatGPT knows you very well, actually. And that's an adieu to you to say that all of you have done fantastic things for yourselves. And I think for institution, and DBT is proud of NBRC for what all you do actually. But it's interesting what all things from very soon from our own M's of our life will in fact be taken over by AI and generative AIs actually. It will start to invade every part of activity that we think as a student, as a philosopher, as a teacher, as a person to really think that this is what I should do. For example, I believe reviewing papers will become redundant actually. The ChatGPT version of reviewing paper will come and it will review much more better than what any one of you would look at. Writing theses, writing, introductions. I think it's probably one of the best times that it gives space for you to think in a genuinely interesting way, such that the chat GPTs cannot actually replicate it in a way that is generative enough actually. So I think congratulations again to all of you, but this is just a way to say that there is a tremendous opportunity for all of us, as Professor Murthy rightly said in the end, that all of us come back to India with a hope to change this country or change the world. And I think that light of thought process should not go despite 25 years of presence actually. I think it should just ignite even more and much more bigger for its activity to do. So what your director wanted to talk to me was about, he said, why don't you talk about something about BRIC, because people are still very unclear. So just to give you a perspective, all the 14 institutions of Department of Biotechnology are in fact merged as a part of Biotechnology Research and Innovation Council called BRIC. And so from now onwards, NBRC may be better called as BRIC NBRC. And I think there are lots of benefits and advantages of it actually. I think one of the biggest drawback of NBRC that I've realized over the years is the scale. It's the scale of activities with 15 or maximum of 18 faculties and maybe about 100 students of what you have. This actually does not resonate with the country's real ambitions and its aspirations. And therefore, it is very critical and important that more we get connected, more we realize scale, more we are able to do activities. I think, for example, your NIMHANS has a faculty of close to 250 people. All India Institute of Medical Sciences is about 800, 900 people. All IITs have an average of about 700, 800 people for the last 25 years. So imagine the number of people who they create, number of people, activities they can perform, and the value they can bring to an organization. So it's tremendously important that we collectively address these problems. And that's why I think the BRIC is going to be a tremendous opportunity for us to innovate. But this is something that, if you really look at institutions these days, we are all asked to do so many activities actually. They will say you innovate, you provide good infrastructure, you generate technology, you have a social impact, you have startups, you have various financial models for your own success, you look at sustainability, and you also do inclusivity. Now, can you imagine NBRC doing all of these with the strength that you have? Well, you will do it and you are doing it. But the challenge is to do it well such that it's impactful and it's decisive and it's value addition. And I think that's what the BRIC will try to do, is actually try to address each one of the institutions in a way such that we bring value for it. And this is the slide that why do we need BRIC? So if you really look at all our institutions, the genesis primarily was pursuit of knowledge, creating infrastructure and capacity building. And this was the pillar of all institutions that were associated in India actually. I mean, for example, NBRC, because there is no brain research institute in the country, you can go back and look at the cabinet note paragraphs. They start by saying, the knowledge is a pursuit. Look at what is happening in 21st century. The science, technology, and innovation is thought to be a critical driver of societal change. Now, this is something that is very difficult to understand and imagine for scientists of us who have been working in laboratories. How can I make a societal difference? But you can hear all premiers of all the countries in every speech, they use science and technology as a way to solve people's problem. At least Nimans addresses people's problem actually by treating them and by creating them. But institutions of Department of Biotechnology, how will you do that? And the more so is to be a of change and development. So you can imagine that there is an onerous responsibility on scientific institutions these days to in fact become better and bigger than what they were from their perspective when they were all initiated with of pursuit of knowledge, creating infrastructure and capacity building. And therefore, I think what this BRIC institutions, what we call them as iBRIC actually, a name given to this by all the BRIC institutions called iBRIC, will enhance and implement the transformative power of SNT for the benefit of all, and also will define bold gold actions for driving bioeconomy actually, because one needs to define and take leaderships in the world. And there is no other way that without SNT that you can have leadership in any part of activity you look at actually. And therefore, with these two basic aims, we're actually driving BRIC as a perspective to look at. So Department of Biotechnology, your perspective now, in fact, had its first society meeting on 2nd of December, and all institutions now, in fact, are a part of BRIC. And we have another institution called Regional Center of Biotechnology, which is actually in Faridabad, an international center for genetic. So now we have two autonomous institutions, Department of Biotechnology, one international center, and that's the portfolio that we have actually. And this is what we believe has to define the directions of how bioeconomy will change this country in the 21st century. So how do you restructure for value and impact? So obviously one of the key things is to build research synergies, strengthen and align science and technological innovation ecosystem. Lots of things happen in every place in a very fragmented way actually. And even in our DBT institutions, which are top of the class in terms of their technological prowess, everything still happens in a way such that it's fragmented and it's not united, and it's all kind of, happens here and there. One needs to consolidation, as our Dr. Murthy also rightly said, it's a time when people who work in, she was giving example of neurogenetic people, neuropsychiatric people, neuromolecular people, to be able to come up together and come up with a plan such that one can actually concretize the impact of it. The second is obviously the continue to build capacity, because the workforce transitions is going to be very, very crucial actually. And what BRIC is going to do is come up with a new PhD program, which will have an immersion-based activity as one of the major part of the work. And I'll give you what that means actually, immersion idea of giving it to PhD students. So third of it is global positioning. It's very important that institutions take policy matters as a serious technology development activities, because that's the only way you can define the contours for the future of the country. Otherwise, somebody else will define you and you will try to follow them actually. And I think that's where the SNT institutions have to take up these activities. And finally, we need to work on asset monetization, management, and monetization. So we need to provide compelling technologies, develop technologies, transfer them, be able to make money, such that you can demonstrate that all these activities can be done in a way to build a startup ecosystem as well. So this is the structure of BRIC. For those of you who are not aware of it yet, the minister is the president of the society. There is a governing body whose meeting, as I said, happened on 2nd. The Financial Advisory Committee and the Research Advisory Committee advises them. And there is a BRIC, which is a Director General, which everybody wanted Secretary DBT to take this position. And then BRIC Research Institute is all the directors, and the governance committee and the RAPSAC will work at the lab level. So we will have this structure that we will use to be able to carry forward our agenda as we move ahead. So the idea really in Department of Biotechnology is to build what we call the BioVision for Bharat in the Amrit Kaal actually. And all of you would realize that we have no other option with all sorts of climate change related problems that we're seeing in the world, whether it is, and the sustainability has become one of the biggest issue actually. And clearly the sustainability can come once you connect, for example, either biopharma, bioagri, bioindustrial, bioenergy, bioservices, biomedtech or bio-AI. And this is a large portfolio. Mind you, 4% of our present GDP comes from the economic models actually. So it's already a very vibrant economy. But our plan is to make about $3 trillion industry by the 2047. And if you're able to do that, India will be at the $10 trillion industry total of it, of GDP, which will make enormous amount of impact in the future of the country to look at. So already if you really look at, if you just combine all the DBT institutions, you can see the impact. And I've just added last 1 year's data just to give you a perspective why being isolated doesn't really help. You can see the cumulative strength of 1 year data. There are about 2,217 researchers and postdoctoral getting trained. There are 19 startups companies spinned out last year, 7 technologies commercialized, 25 technologies licensed, 62 patents, and 868 patents actually. And if you really do this, we become the #1 life sciences research institution in the country. And what that means is that all of you are part of the top ranked institution in the country actually. And I think that means a lot. That means a lot because it means that we are amongst the best in this country and therefore can provide leadership to the international world in terms of how biotechnological and bioeconomic perspective will lead for the future. The only thing, and I think what DBT is wanting to do is also taking various reforms. For example, the IP policy has been changed now. It's not only non-exclusive licensing, but exclusive licensing along with IP and assignment. The merger and institutions have happened. The genome editing platforms for biosafety assessment has been done. The concept of one thesis, multiple PIs, because of the way theses are being done, can we come up with a model like this such that the PhDs are not isolated, in fact done in groups? All the major programs happen as a collective activity. And finally, can we extend the age of active scientists to 65 years, which is the agenda? So if you become large enough, you can set agenda. And that's what my perspective to tell you is that if you're very small, you cannot set any agenda and you cannot dictate anything, but you can only want and ask for it. So become stronger. And I think this strength will drive our all these ambitions to take it. And what we have done is the first program that I think you must have talked about it as well, actually, that we launched from all our that day by Honorable Minister to actually what we call people-centric movement of zero waste life on each campus. So I think what we're going to do is going to set every campus of Department of Biotechnology as a test bed. And this test bed would therefore be able to define how to lead sustainable life how to be able to lead a sustainable life in various campuses in various parts of the country. And therefore I think you should take this as this is a people-centric model. It's either you are a child, technical officer, or you are a spouse person working on the campus. All of you can participate in every single part of the country, DBT institutions, such that it defines this is the way you can have zero waste campuses. This is the way the sustainable life can be defined. And I would really love, since the spouses are here today, that please some of you take up this as a responsibility to activate and motivate and drive this agenda as part of future of the country. And I think these models of test beds can in fact then be written it out and then implemented in different ecosystems, different environments, different ideas, so that one can create awareness all across the systems. And similarly, these kind of activities can be managed. Also, as I said, for the PhD students, really from inside out strategy, I think many of us are happy here in the lab in an Eppendorf and very happy to work and think about what we can do. But really what one needs to do is to leave the lab of confinements of lab and immerse in the real life challenges actually. And I think the most critical of all is to really understand, why am I required to do a PhD? What are the problems that I need to solve? How do I resolve it? And how do we look at it? And I think the whole idea of this PhD program is to instill the importance of connections and collaborations from an early stage in your career, because just your own thesis is even insufficient to write a cell paper. So how can you write a cell paper in life until and unless you collaborate and you coordinate with activities? And really to do this, I put up my poem that is my favorite poem, I think, which is like it's like we need to break the stereotypes in life. And I think this is the most critical problem. It's the human mind that has created all the stereotypes. And this is the kind of a challenge that one needs to overcome. And I think this poem gives you a very nice perspective of it. भैंस की व्यथा भैंस की जबान से actually. So भैंस, is like a poor animal, and how it is treated is what is shown in this. It says जब बच्चा जब थोड़ा बड़ा होता है तो दूध मेरा पीता है, वो भी तो बोनमीटा डाल डाल कर, और निबंध लिखने के लिए गाय हाथी या कुत्ते क्यों. And you can see nobody ever writes on bhais. You'll write an essay on guy, you write on how is the dog, faithful animal, but you never write on this actually. अगर बच्चा लिख नहीं पाता है तो बोलते हैं काला अक्षर भैंस बराबर, तो क्या दूसरे जानवर पोस्ट ग्रेजुएट है. And so bhais is always associated with some downside of the life. There's nothing wrong with the bhais. यदि कोई गलती करे तो कहते हैं गई भैंस पानी में, तो बाकी के क्या जानवर कोका कोला में जाते हैं. और कोई ना सुने तो कहते हैं भैंस के आगे बीन बजाना, बाकी के आगे क्या लता मंगेशकर का गाना बजाते हैं, क्या बिगाड़ा है मैंने. So you can see one animal has a label, and that label is that this is a negative connotation of life. And I think that's what we need to break. Science, technology, and innovation does not necessarily mean only working in your labs. It means doing things that was much more and much beyond your labs. And I hope this will drive your thoughts and ideas for future. And I'm sure the BRIC is going to drive the agenda of bioeconomy for these countries' future. Thank you.
Thank you very much, Professor Gokhale, for that inspiring talk. So we have one more job for you. We have to distribute some prizes for academic excellence. Yes, and I will ask Professor Murthy to join as well. So these are the stars who will take this vision forward, I think. So first I would like to call Dipti Chakraborty. She stood first in the PhD coursework. So next I would like to call Chakshu Mangal, who stood second in the PhD coursework. Chakshu. So we have a PhD comprehensive viva voce for getting into the lab. So a person has to clear exam, which is viva exam, which includes the syllabus is practically all of neuroscience. It's pretty difficult exam, and I think I couldn't have passed that. But Dikshali Basi, she stood first in that. So I would. Astha Vartak, who stood first for the MSc coursework. And Ankita Roy, who stood second in the MSc coursework. So thank you all. I think that brings us to the closure of the ceremony. And Before I go forward, I would like our dignitaries to get to the seat, please. Yeah. Okay. So I would like to hand over to Professor Rai to give the vote of thanks.
Okay, so we have a lot of people to thank to, and this program was a culmination of intense effort by all of them. So I can't single out a single one of them. So I'll generalize everything. So it involves the administration and finance. You know, they have been very busy preparing all the files so that it doesn't attract audit observations, and that was very critical to have all these things. We want to thank the Welcome DBT, the DBT CTEP, the Department of Biotechnology for all the generous funding that we had.